right, so this is some quotes taken from students in an article by Burkhart and colleagues, and it really highlights oof, what's the word I want to say that's professional? The, uh, hmm, this, I'm gonna say sad, but I want a more angering word, but sad is what's coming up to me. So the first quote is talking about students talk about just how much they begin to hide. So within this article, they're talking about different supervisees of color, and those who are also part of the community. And they note several different examples where supervisors had blatantly been racist to them or anti-LGBT in the statements or attitudes that they currently have. Also in the way that they've simply just dismissed parts of who the supervisee was, or that culture was a meaningful part of supervision and clinical work, which we know ultimately it does. Oh, wait, go back. The second quote is saying they are really just trying to get through the experience at that point, talking about the supervisees. And supervisors often have a limited idea of what supervisors are doing with their clients. So not only is it important to make sure that we are integrating culture, different strategies, we're demonstrating and modeling for our supervisees of how to have conversations about culture. We also, if we don't, then we may, as a supervisor, really be missing a big chunk of what our supervisees are doing, right? And as a supervisor, that is one of our like fundamental requirements or roles that we have is making sure that client welfare is at its highest standard, right? And so if we're not getting a full picture of who the supervisee, who the client is, we are going to miss things, and that could be very detrimental to us as a supervisor. All right, so now we're going to move into best practices for culturally responsive supervision. And this section is broken down again based off of what the research is saying, best practices, and then we're going to review some clinical supervision models that fit with supporting culturally responsive supervision as well. All right, so research says, some of this may be familiar, but I think it's worth just noting or repeating, right? So when there is a supervisee, a supervisor, supervisee, and a client and a supervisor who have different cultural backgrounds, which really means everybody, right? Because we're all different in some capacity. This requires additional competence. And so that competence can look like in general competence, like these are some general ways that you work with people that are culturally different from yourself, such as broaching, cultural humility. Let me see, what are some other ones? I'm thinking of another one. Just being open and flexible, right? So those are kind of some general ones. Then you might have cultural skills or cultural norms based off of kind of the culture that you're working with, the different identities or how those identities intersect for a client as well. This is always the responsibility of the supervisor. And I'm going to say it again. Bringing up cultural issues or cultural considerations is always the supervisor's responsibility. I really liken this to in the counseling space, where I think also sometimes broaching, I think of where we as counselors may be nervous about broaching because we don't want to offend, or if there are differences, we don't want to shed light to it versus similarities. However, when we don't bring some light, or at least when you broach it with the supervisor or the supervisee to the client, it allows the space to be known. We can discuss cultural considerations. We can discuss cultural issues. We can discuss areas of growth where I'm not so strong, that I need to work on with the supervisor. So it is our responsibility to do that. What this also does is it sets up this parallel process with the supervisor and the counselor. And so parallel process is just typically how we're seeing the supervisee may also be how we see them in clinic or how we see them in counseling practice with their clients. Um, so if we are modeling over here how to have cultural conversations, that means our supervisee is then gaining those skills to have those cultural conversations with our clients, which is important. Research has shown a ton of research has shown like when you do this, it works. I remember I read an article that was focused on religion and counseling. And so religion, like 90% of the world has some kind of religious or spiritual practice. But broaching was only occurring about 40 to 50% in counseling because people were probably either, maybe they had their own biases against spiritual or religious, or they didn't want to rock the boat, or whatever it might have been. But we've got a world where 90% of the folks are like, hey, I tap into this, I tap into that, and a counselor isn't tapping into that to bring it in if it's healthy, right? If it's healthy, to bring it in and add to the counseling space. And so the client may interpret that as, okay, we don't talk about those things, or, maybe they don't like my religion or whatever it might be. Or they might just not care. The last thing is the quality of discussions also about cultural considerations. This prompts greater insight for your supervisee, a stronger alliance, supervisory alliance, and a high level of satisfaction for supervisee as well. Now, in order to have these quality discussions, you also must have the knowledge, the skills, and the abilities to do it in an effective way, because supervisees will notice if it's not genuine, right? So that means as a supervisor, you are having to do the work on your skills, on your knowledge to be able to have these culturally relevant and responsive conversations in clinical supervision in a way that is true to who you are. This is a 5-year review, and it's a little dated because it's from 2005. But there was a new article in 2016, I believe, that aligned very closely to what the 5-year was saying in previous years. So discussing multicultural issues was best done very early on in clinical supervision. So one of the first things you want to do, and that might look like I call it an intake with my supervisors too, because I have a contract, several different contracts. I have my clinical supervision philosophy. So I have a couple things for them to do. Maybe this also looks like, for me, I send, there are lots of different acronyms of different identities. So maybe I might send that. Maybe I might send one of the inventories that we'll talk about later, the multicultural is it attitudes, knowledge, and skills survey. And that's a conversation that we have. Some other ways that you can also do this early on is having some semi-structured questions, open and closed, that maybe you give to the supervisee, or you all talk about it during supervision so that you can get a little bit more information. This oh Lord, I can't talk. Reciprocal exchange. So the supervisor and the supervisee are both exchanging this information, right? Because it feels kind of weird when you're just discussing yourself with things that might be a little uncomfortable to talk about, and the supervisor is not. And so I would reflect on for yourselves the limit, right, of which you are comfortable sharing things. But recognizing that also this last one, supervisor self-disclosure about the process of becoming a culturally responsive or culturally relevant clinical supervisor or counselor, is very, very helpful for the development of your supervisee. So just like in clinicals or in counseling, you would, have limits of what you want to share, don't want to share with the supervisee. or with a client, sorry. So in clinical supervision, you may handle it the same way, but ultimately I would really consider, that process of what you're currently doing, right? And you should be continually doing things because we're humans, we work with humans, and we are always changing. It's a crazy thing. And so that process can be really cathartic for a supervisee. In addition, we've got, some stuff going on here in terms of the number of continuing education credits, percentage of time, receiving and providing supervision with a multicultural focus was positively correlated in terms of a social justice attitude for a supervisee. Clinical supervision is um, a technique, a process of its own, right? And so we all have to go through it. And so it would be really meaningful. If it could be something valuable that a counselor or therapist can have, where it helps them in understanding social oppression and its effect on clients' psychological well-being. And that social oppression goes back to kind of that Bronfenner or ecological approach, and understanding our clients within systems, understanding your supervisee within systems, and then understanding yourself within systems, and how we all work together in this space to provide services to the client. Again, supervisees have the responsibility, and they also are responsible for processing when supervisees might be struggling with a particular identity or culture as well, and providing the best service that they can as well. And then lastly, on the left, we've got the most positive themes from this research study and the most negative themes in terms of supervision. And so one of the major themes were multicultural supervision competencies. And guess what was the negative? A lack of it. So supervisees, they want to know more about culture. They want you to share it with them, and they want to be in it with you. Okay. Another, I think, important piece was positive was the personal attributes of the supervisor. Again, I think this helps in building that safe environment that's inclusive, and also a space where mistakes can be made and areas of growth can be discussed. And then another one over here is a negative theme. And again, so we talked about quality of discussion of supervision in the other research study. A supervisor who was having difficulties as a visible minority was also a negative theme. So in one of the activities we'll talk about later as an example, discussing the different type of identity models. So there are race, ethnicity, sexual orientation, social class, a supervisor who's maybe not doesn't know where they are on those models or doesn't know where they sit comfortably, it can be noticed also by supervisees. It's like they're